Alright, hello. My name is Adrian Lopez, and I'm with my partner Pius. And today we'll be talking about the effects of anabolic drugs. Alright, make sure to like and subscribe before the video comes on, and hopefully enjoy the presentation. Alright, so we'll be talking about the effects of anabolic drugs. But before I'd like to start, I'd like to give off a disclaimer. The following presentation shows data related to scientific research and is intended for educational purposes only. All right, we're not encouraging any of this. We're not telling you to go take it. Well, we actually aren't, but we don't want to encourage it. All right, none of the items presented are encouraged for the following research and should not replace independent judgment. Please do not be gullible. Make smart decisions. A works cited page will be dedicated by the end of the presentation to show all of our work. All right, we're not plagiarizing. All right, so what are steroids? So steroids, they're a form of artificially enhancing our biological self, whether it be physically or mentally. Steroids allow us humans to exceed our natural limits, such as the things that Mother Nature gave us. Steroids allow us to break that barrier and go farther beyond that. Physically, we gain more muscle. We could look better. Steroids could also, well, in medical senses, you could withstand more pain. You could heal faster, actually. You could get rid of rashes. That's another way. Mentally, we could actually, again, you can withstand more pain. Again, you could actually withstand more stress as well. Some people, in senses where some people may have a breakdown. Some people may completely give up. Some people may even have life-affecting symptoms. Stress is a very powerful emotion, a very powerful hormone. Steroids, what they do, they mimic hormones. So by that way, they can actually stop that. And we can essentially become stronger, better humans. But it's not always recommended because Mother Nature didn't allow us to be like that. And there are consequences. All right, how do steroids work? So the way steroids work is they're molecularly structured to mimic the body's natural testosterone. Anabolic steroids are either testosterone or derivatives of it. In that way, testosterone is a hormone. All right, anabolic steroids, they mimic that. They're not actual testosterone, or they may be actual testosterone. They're extra, similar to vitamins, but these are hormones. So these will affect your body differently, and they will actually affect it faster. They're all classed under the androgen umbrella. All steroids being classed under the androgen umbrella is the male sex hormone. By male sex hormone, we mean the characteristics such as being faster, being stronger, being taller, honestly looking better. Like this is just scientific. This is not in any way pretend to men sexually. It's simply just by history, men have had to be stronger, have had to be faster, and normally do be taller by other cases. But we do not discriminate. The scientists do not discriminate. They just go like that. The body has a lot of receptors for different hormones all over the body. Anabolic steroids activate the androgen receptors in the body, many of which are located in the muscle cells. Although some can be in bone tissue, kidney tissue, skin tissue. By these receptors, meaning where do they affect? Most steroids are they're normally used to enhance muscle growth. Although not medically, most people that take them do take it for that reason. But they're also located in bone tissue to increase bone health, bone mass as well, such as growth hormone growing higher. Kidney tissue, creating more bile, which can digest food faster, make you lose weight more. And skin, they can actually get rid of acne as well. They have a lot of different things. Steroids are, in a sense, very beneficial, but they do have consequences. So how can steroids be administered? There are multiple ways that steroids can be administered, but the main or most commonly known administered is via intravenously or through a syringe. An example can be through cows. Trenbolone, more known as tren, is injected into the bloodstream. This allows the individual to experience an increased growth hormone and increased muscle or media size. Other forms of administration is an orally in liquid form, such as MK677. However, well, this drug I just mentioned, it's still not really considered a steroid, but sometimes it is. In medical sense, these are done to treat allergies, taking them orally, or inflammation, such as heavy painkillers. Finally, there's a topical steroid that come in ointments or creams. Again, this is done to treat allergic reactions of the skin or inflammation, which can soothe the skin. Unlike other forms of administration, granted the medical uses all vary by the situation or patient's choice on certain forms. Alright, medical choices. Male hypogonadism is a condition where the body does not produce enough testosterone, and anabolic steroids are prescribed to help restore normal testosterone levels and alleviate symptoms associated with low testosterone. Hypogonadism is low stimulation in sex hormones. Anabolic steroids are used for certain types of breast cancer and can help due to the estrogen level lowering capabilities, which can also inhibit the growth of estrogen sensitive cancer cells. People who have cancer and AIDS often feel muscle atrophy. Anabolic steroids are prescribed to the people and increase the number of androgen receptors in skeletal muscle, leading to improved muscle size as well as strength. From a psychological standpoint, anabolic steroids have often been reported to enhance feelings of confidence, motivation, and attributed to elevated testosterone levels. Well, there's medical usages, but there's also illegal usages. Anything that is not given to you by a doctor should not be taken. And if you are, that's illegal, at least in the United States. There's many countries that actually, they don't have regulation on steroids. There's a reason America has steroids, because they do care for your health. Professional athletes have a drive to be the best in what they do. All right. Sometimes training tirelessly does not give them the results they wish for, so they turn to anabolic drugs. Although only the athlete is the one taking the drugs, it affects the athlete's competition. So it's not just the person who's taking it. It's not just you who's taking it. It's also the people around you. In this case, the athlete's competition is affected because it'll give him or her an unfair advantage. We can cause them to perform better than the competition, even though, let's say, everyone's putting the same amount of work. For example, Tristan Thompson, a professional basketball player in the Cleveland Cavaliers, was caught using ibutamoren and Ligadril. Ibutamoren increases a person's growth hormone levels by binding to the ghrelin receptors and activating them. Ghrelin receptors are normally, that's your hunger hormone. These people would normally eat more, increase their consumption, their absorption of nutrients, and will become more active. Ligadril mimics testosterone effects by selectively binding androgen receptors in the body, enhancing anabolic activity. As punishment, Thompson was suspended for 25 games. Giuseppe Ippolito, a professional bodybuilder, was caught using 14 banned substances and stimulants in 2017. 14 banned substances. And he was provisionally suspended and faced possibly a 4-year ban and potential criminal proceedings.
So, starting off with the short-term effects of using anabolic steroids, these are just the things that can happen pretty quickly once someone starts using them. You might see acne pop up on your body or your face, and people might experience mood swings and feel super tired all the time. And some steroid users will get really restless or anxious and might not feel like eating as much as they could before they started using them. And trouble sleeping is also common once someone starts using them. And for males, steroids can lower your sperm count and cause problems like impotence. Now, the long-term effects are more serious than short-term effects. One of the biggest things people talk about is roid rage, which is just extreme anger and aggression expressed by the user. And it doesn't just stop there because steroid abuse can cause paranoia, delusions, heart attacks, and even strokes. And it can lead to more serious problems than that, like kidney failure or a tumor in your liver, which are all super dangerous and life-threatening. And if people inject steroids via an injection, they can contract a bloodborne disease like HIV or hepatitis. These effects might not show up right away, but they build up over time and can be very life-threatening. And finally, some overall side effects that affect both how you look and how your body works once you start using the steroids. For males, the steroid use can shrink your testicles and cause breast growth. And for females, they can experience extra body hair growth, a deepened voice, and menstrual irregularities. And steroids can mess with your ability to have kids, cause high blood pressure, and raise the risk of experiencing heart problems in the future. Mood swings are also a big thing, and strokes can also happen. So even though steroids might seem like the shortcut, they come with this long list of risks that aren't really worth it. And to sort of sum it up, using anabolic steroids when you don't need them for medical reasons can be super dangerous. They might give you a little boost at first, but the risks are not worth it in the long haul. Like we saw in the previous slides, abusing steroids can lead to serious health problems, even life-threatening ones. The more someone uses the steroids and the higher the dose they inject into themselves, the more damage they do to their body. And in the end, it can cause permanent changes to the human body that you cannot undo. And this is our works cited page. Thank you.